As of April 20th, the Centers for Medicare and Medicaid Services have approved their 53rd Section 1135 waiver. And this one comes from the state of Wisconsin, and that's where we are. This is the one we've been waiting for. It took a little time to get it to the feds. Wisconsin had to go through a virtual legislative session to actually get permission for the Department of Health Services to submit this waiver request to the federal government. They finally got that permission by the governor signing Act 185 into law. The waiver was sent to the feds. They very quickly approved it. And the process for approval went so smoothly because Wisconsin followed in the footsteps of the prior states. Using that CMS template, that toolkit they made available for all states to use, Wisconsin mimicked some of the provisions of states like Washington, California, Florida, to have a Section 1135 request go in that would give some flexibility to be more responsive in its Medicaid and Medicare programs in this coronavirus pandemic. Now, this waiver request coming in for Wisconsin dovetails really nicely with some of the federal blanket waivers, and we've talked about blanket waivers in a separate video, but it just gives an extra layer of flexibility this time to the state specifically. Let's talk about a couple areas that the Wisconsin 1135 waiver covers. First, it temporarily suspends some of the Medicaid fee-for-service prior authorization requirements. It also extends some of those pre-existing authorizations through the end of the public health emergency. And when we say pre-existing, we mean anything that would have been approved before March 1st, 2020. Those authorizations can continue without being renewed or reviewed until this public health emergency is over. Then there are a couple other provisions that were approved, suspending pre-admission screening and annual resident review. These are those assessments that happen for 30 days. It also extends, and this is what looks very common to all the other states, extends those provider enrollments to out-of-state providers. So if somebody in one state is an approved Medicaid provider in their state, it kind of borrows that permission to have them be a certified provider in Wisconsin as well. Also addresses some of the criteria in reimbursement for those claims that come in from those out-of-state providers. It also addresses provision of services in alternate settings and addresses some flexibility in state plan amendments. And let's talk about that a little bit more. The approved flexibility applies only to those state plan amendments that provide or increase beneficiary access to items and services related to COVID-19. And in the approval letter from CMS, they give some examples. They talk about cost-sharing waivers, payment rate increases, or amendments to some of those alternative benefit plans to add services or providers. That would not restrict or limit payment or services or otherwise burden beneficiaries and providers. They're trying to open up some of these services, not be more restrictive. So they say typically when you're going to have state plan amendments, you have to go through a federal approval process and you also have to have public notice. We don't have that kind of time right now in this state of emergency. So the feds have been particularly flexible with waiving some of those timelines. And that's what they did here for Wisconsin. They waived some of those timelines about adding or changing state plan amendments and waiving that public notice requirement. Of course, it does come with the asterisk where CMS encourages the state to be as transparent as possible, knowing that this public notice requirement won't be fulfilled. Now, unless otherwise specified, here's the duration of when this waiver is effective. Starts March 1st, 2020, so it actually backdates to March 1st and runs through the duration of the public health emergency whenever that ends, acknowledging that maybe there's an extension that could be applied, in which case this waiver runs to the end of the extension. CMS also said that they will continue to work on additional waiver or modification requests that are not currently reflected in this approval. So they acknowledge Wisconsin might want to do more, and they pledge to work with Wisconsin to do this as quickly as possible. If you want to read that Wisconsin approval letter, we link to it in the description below.